You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Mosquito, a good friend that I met about a year and a half ago at the inaugural Vive conference. And for the last year and a half, we have talked about having him as a guest on the show, and it's finally happening today. So Mosquito is the president and CEO of Health Innovation. Welcome to the show, Mike.
Thank you very much, Dr. Roxy. Glad to be here. Glad we're finally here talking, chatting together. So looking forward to a conversation today. Looking forward to being on your show.
Thank you. So tell our audience a little bit about your background and what you're up to these days.
So a little bit about my background, degreed engineer, mechanical and materials engineer, but have an MBA in business information systems management and IT. So from there, I went to claim a job as an engineer for a little while, but then became a CTO for the big .com phases of life. And then moved on from there to having several executive positions at McKesson, Allscripts and Eclipsys, and then moved on into management consulting. So worked for several mid-market companies, consulting across several industries, stayed primary to healthcare over that time, but really maintained a foothold in emerging technologies and industries that were leading the market in evolving how people do better things within their companies and across their continuum of industry. So today I'm looking forward to talking to you about what those things do to change healthcare.
And there is so much change happening, right?
Yeah, so much change happening.
Yeah. So let's just start off the conversation talking about a little bit about the digital transformation movement that has kind of been in place for a while now, certainly accelerated by the pandemic. And then and then also this idea of experience transformation.
So I'll tell you, as we talk about digital transformation, which, it's been used for quite some time. It's not a new term, it's not a new phrase, but it is how is it being used within healthcare and other industries today. And it really is taking what you know about your technology, your infrastructure, and how are you moving faster, moving more efficiently within your organization. And that transformation can happen, whether it's with people, it could happen in your processes, it can happen in your technology in that platform. And there are tools that are being brought to market that accelerate that. And we don't need to get into the specific name of those tools today, but I will tell you there are tools that accelerate that path to better efficiencies within the environment. Those tools that allow you to have a better optic on your performance of your people, your processes, and that technology that you're either purchasing or currently using. So within healthcare, as we talk about the front end of care with patients, we know during the pandemic, we've been talking about telehealth. I sat on the first telehealth panel here in Georgia, and that was quite a while ago. But it took a global pandemic for it to instantly be put into use by most hospitals across the country. And so, again, out of necessity comes technology. Things like telehealth was one of those. We're looking at the AI emergence today at a rapid pace, while the adoption of the internet took a small amount of time. The adoption of AI for everyone from a 5-year-old with an iPhone to a 70-year-old man sitting in front of his desktop writing letters back to his kids they're using AI today. They've learned how to adopt this technology. But in healthcare, it's being used to bring better care because you get a better look at that continuum of information that's out there. That's within the four walls of a facility or within a healthcare continuum. But in the future, I think this adoption of technology can look at a global landscape of treatment and bring it to one patient, to one need. So while I'm looking at a doctor within one facility today, I can look at 100,000 doctors that are working on those same protocols, those same diseases globally that will be connected through an AI bot that brings that information together and can be used to treat patients in a better and more efficient manner.
So one of the things that I think is so fascinating about AI, and almost like, let's say, using it as a comparison of telehealth. So telehealth has been around for over 30 years.
Yes.
And it took the pandemic in order to get healthcare to adopt. But if you compare that to AI, healthcare tends to be a laggard industry compared to all these other verticals, right? We're, usually the later adopters of almost everything that's out there, right?
Right.
It's only when we're forced into it are we
Right.
embracing it, like the pandemic, right? But with AI, it's happening so much rapid, fat quicker, that, to me, it's mind boggling to see healthcare almost at the forefront of the adoption and implementation of AI compared to other verticals. Where you've got Google coming up with MedPalm 2 that's specifically for healthcare. Why is that? Like, what's happening that we're paying attention to AI now when we've maybe have ignored all of these other advancements for so long?
I think the testing of AI in healthcare is one of those where there's so many efficiencies that can come about, and we know those efficiencies are there to be brought to either the system itself or to the patient. And AI is proven to be a tool that can bring those efficiencies forward. We'll start with just the help desk. We'll start with the help desk within a health system. And you've got bodies that are dedicated to answering questions, whether it's can I bring fish to lunch, as a question you can ask internally. Well, there's no reason to call help desk anymore. I forgot my password. I've forgotten, how to get a laptop or a new monitor. Those questions now are automated. So your service management is automated, which means you've got a cost reduction for putting a body on the other end of a phone to fill out a ticket to answer a question. The simplest method is, how do I get these tools like AI to transform my organization and create an efficiency that can be used and monetized? And so from a patient standpoint, when a patient has questions, they send a message to their doctor. Now those doctors for the physician's inbox can be triaged by an AI bot and responded to. You can put those in a queue, and now the physician's inbox is not delayed. The efficiency for that physician is increased. And so you're looking at these tools now as a way of getting your doctors happier, your patients happier, your system more profitable. So I think that's why the adoption of these tools, on the IT end, typically getting 3% of the budget for what they're going to use for their tricks and toys and to keep the lights on, can now be pivoted with AI. You've got more efficiency, you've got less bodies to take care of, and you're letting that tool do the heavy lift. And so when we talk about doctors, nurses, how to increase their efficiency while they're not answering questions, you've got a tool answering that question. So I think that's what we're seeing now. You're right with MedPalm, Google bringing that out. We talk about efficiencies in answering those physician questions. While you'll always need a doctor that can actually have some common sense and can actually put thought behind why do we have this diagnosis, I think bringing it, and I think MedPalm 2 and a couple of other tools have received 80% or better in the results and analytics for treating patients.
Yeah.
So as we talk about looking at how do we use these tools, I think the analytics behind answering medical questions and that throughput to the patient is going to be increased. And it'll get better as we get past MedPalm 2, MedPalm 3, GPT-5. That
Yeah.
efficiency and that ability to move to the next stage will increase. The next stage of care, I should say, will increase.
So I think you're right, and I think also, it's almost like there's this convergence of market trends that are happening that
Mhm.
create this like perfect storm for we have to do something, right? With the physician shortage, the nurse shortage, the hospital systems being in the red from the pandemic, it creates this perfect storm of we have to do something, and if we're going to keep the lights on. And so then we're looking at how are we going to leverage technology to be able to reduce cost and to be able to increase profitability and to increase satisfaction so that way we can stay competitive and keep those providers, those healthcare professionals.
Absolutely. And in the future, those patients, the patients keep the light on. You need a patient in a facility to keep those lights on. But think about a patient that's not in the facility and you're wanting to keep up with their care. And if that care is telemonitored and a bot can read or an AI can read, an augmented physician can read that data and take the collective of data around that treatment protocol and then provide an update based on trended elements. Here's how you're doing. Here's what you should be doing, and here's how we're going to address those protocols. That's checked off by a physician at the end of doing that analysis. So the patient has a better care program that's not in the facility. That's remote. That's remotely monitored. And now you've got another body that's not on the daily basis answering questions about, hey, I forgot to take this med. How's that going to affect me? You're not sending messages into a queue for a nurse to have to answer. You've got a nurse augmented reality there, where that reality is actually feeding and caring for a patient, but also providing funding back to the system.
Yeah. So, whether we're talking about AI, telehealth, or whatever the tech-enabled improvement is, there's a lot happening, right? There's a lot of innovation, a lot of ideas. So kind of walk us through, because you've worked with hospital systems for a really long time now. So help walk us through what progress have we made on the digital transformation front, and what are some of those lessons learned or opportunities of like what's next?
I think the lessons learned is how to trust the cloud for data storage, data use, data collaboration, and how the analytics now are telling new stories for either professionals, doctors, researchers, and using that data to actually develop new companies that are using it. And that's from pharmaceutical research. That's from technology to support that research, because now you can actually have a person move from one pharmaceutical company to another and help be a remote employee or an augmented employee, because that bot can collect information from many different people, right? From many different protocols. And I think that as we talk about that transformation within healthcare, it is how do we look at these technologies and put them to use for a future good? And that future good could be what we saw from the iPhone, original use of a bag phone, now to what we hold in our hands, right? How is it used today? Now, if you fall or in a crash, that tool can alert someone in that moment there's been an accident. Same thing for these new tools for AI, GPT-4, that are going to be put in sensors. When something happens, it now is an immediate trigger back either to a financial system, a doctor, a nurse, or an IT administrator, that there's been some kind of incident. And then it can actually preemptively go ahead and alert and start triaging that event. So it really is, these tools are being developed and put into place because they can act much faster and react much faster than the human can. But then there's some decision support needed on the back end to triage, okay, did it make the right decision based on this situation? Because there's some common sense, and you never want that full access to cost you in the end, because it made a pivot to set off an alert that wasn't needed. So again, human intervention is going to be needed. I think Steve Jobs said, efficiency should be left to the machines. Humans should be left to the decisions. And so we let the decisions be made by humans, and those efficiencies be elevated by these machines that are coming about. Machine learning has been around for a long time. We now know that we're going to rely on that for the future state of our world and its current existence. And these AI interactions and these augmented interactions are going to increase, one, how we develop technologies, how we deploy these technologies, and how we consume information that supports them.
So what is the greatest top priority right now for the CIOs and digital health officers? Because they are overseeing so many different components of this experience in digital transformation. And what's their number one priority that they're having to solve for right now?
I think in experience transformation, let's pivot over there for a second. I think it is one, internal to their employees. How do I take care of my employees and making sure that they are being fed and cared for as needed within an IT organization, within a healthcare environment? And so what am I providing to understand where should they be playing with this new reality?
Yeah.
And making them feel comfortable with this new reality, especially since we're talking about AI replacing jobs. We're talking about AI taking over. Their job is to make sure that their people are comfortable with this reality that AI is coming, but here's your place
Yeah.
within that continuum of IT care. And here's how we're going to use this technology. And no one's saying that GPT 4, 5, 6, 7 is going to replace all these jobs in healthcare, but it's how it should be used to augment that care continuum from IT. And so that CIO has to create their strategy around that use of technology in the people and how it will support the overall strategy of the health system. So
Yeah.
I've seen and I've been working on these emerging trends that are tied to AI, but also working on how do we take the experience and that transformation experience from not only internal employees to external patients and what their expectations are, because you have to set an expectation for, hey, the hospital up the street said I can go to my phone. And so you're fighting what could be marketing, and you've got to put some technology behind it. And you don't just turn a switch on these technologies. There's security, there's cyber implications of putting these technologies in place. We know what happened to Samsung when some engineers put code out on GPT 3.5.
Yeah.
They lost that battle, right? It no longer belongs to Samsung, it belongs to the world.
Yeah.
So again, how do you use tools like Bing Chat that's internal to protect your organization, but also as a CIO, how do you use these tools to support the organization at a more efficient rate? So I think these CIOs today are having these conversations around data analytics, data storage. How are we using these Microsoft tools? How are we using these Amazon tools in the cloud to help bring a better data analytics that support our AI initiatives within the four walls of the system and the people around them?
So, how are these leaders determining what they're developing in house versus what they are outsourcing to some of these, more innovative technology experts that are inventing stuff around specific use cases that they might be looking to solve for?
It's a very good question. They're bringing in experts like yourself and myself to help that we look at a landscape, right? Someone
Yeah.
like you and I, we look at a landscape of technologies, and it can be from startup to Fortune X company, and how you're using technology today, and you're wanting a roadmap of how to get here
Yeah.
with AI. It's not, there's not one magic bullet that solves this. There's not one magic solution that solves it, because there's an evaluation of people, process, technology, and strategy that underlies that. And then so consulting is important to this, because you have to sit back and determine, can you consume this roadmap? Can you fund this roadmap? Can your people adopt this roadmap? So we get back to experience transformation and change management. But
Yeah.
in the future, you're going to need someone that's experienced in looking at, here's what is historically done, and they've seen that happen, and here are the outcomes. And then as we move in the future, how do you develop a roadmap that gets you there? And it's someone that stays up on technology. You can't say we've always done it this way. When you start hearing those words, it's time to start moving these people on,
Yes.
because those days are gone. We've always done it this way is
Here's
now
the
dead.
off ramp. Here's the off ramp.
Here's the off ramp for you. Absolutely right. So again, it's how do you bring in folks that are staying apprised and abreast of what these technologies can do, are going to do, and that's across industries, because other industries will innovate faster. They will be doing things that healthcare hasn't thought of yet, and from the financial systems to their technical systems, they will innovate out of the need to go faster, out of the need to stay competitive. So when you find
Yeah.
industries, always look at industries that are staying competitive. And I left healthcare for a small period of time and went and looked at all these other industries and how they innovated and how they brought technology to life within their strategies. And then I brought those back to healthcare. So when I'm looked at as an innovator and an advisor to the executive team, it is about, here's what's working and here are the outcomes. It is always telling, here are the outcomes of this decision. And here's why they made this decision. Here's why you should make this decision based on your current existence today. So
You know,
they're good questions.
I use a couple of examples in related to that topic that you just mentioned often, where, Starbucks, 70% of the new ideas that they launch into the marketplace did not come from their internal R&D teams, that they have a full-blown digital co-creation platform
Hmm.
where consumers are continuously giving them new ideas of what they want, and they have a whole process mapped out of how are they soliciting ongoing 24/7 ideas from their consumers, weaving that into an evaluation and prioritization and then development process, and then getting that launched into the marketplace. And that's how companies like Starbucks and other industries are able to create a culture of innovation, and not even having to have all of the expertise in house, being able to
Hmm.
bring those external customers part of the process, and going, you know what, we don't have to have internal teams that are trying to predict what customers want next for us to create that roadmap. And we're
Hmm.
actually just going to ask them and make them part of the process, and use that as the fuel to become this innovation machine. And I am so anxious to see more of healthcare companies start to adopt those types of practices, so they too can be large organizations like Starbucks, but still be flexible, nimble, and innovating the right things at the right time.
I will tell you, several healthcare organizations are doing that today. Several of
Yep.
our healthcare organizations have venture initiatives going on where they
Yep.
incubate and they
Yep.
bring about that innovation, that thought leadership. Uh, Several companies have started implementing tools that are platform specific, where you can have intake of ideas, and they put them through this system of intake and massaging these ideas internally, and you can receive those ideas internal or external. But
Yep.
it's one, how do you stack rank those ideas? One, you have to have them first. Where do you gather those from? How do you stack rank them based on the strategic plan? And then
Yep.
how much of that can you fund? So Starbucks, right,
Yeah.
as an innovator of that, they're staying ahead because they're listening to, here's what I will buy. Or from a patient, here's where I will go for care, right?
Yeah.
If you did these things, you get my money, you get my care, you get my insurance. So you
Hmm.
have to pay attention to what your constituent buyers are saying and what tools are they using. I would say that most grandmothers in America are rocking an advanced device in their hand today. They've got one of these devices in their hand. So
Yeah.
you've got to say, you can't say it's for younger people. That use case is for this age group,
Yeah.
right? It's gone. It's that age group uses this technology, and
Yep.
here's what needs to be in that technology for us to be able to capture them, be able to market to them in the right way, and be able to make sure that we provide them a sense of understanding. Here's what my organization is going to do for you if you're using those tools. And
Yeah.
Starbucks says, if you come here, we're going to give you that experience and those coffee or treats or whatever that you've been looking for. We're going to customize that experience for you. So experience transformation
Yeah.
is key. You're transforming your client base, but you're also transforming and enhancing the amount of revenue you can receive from that transformation.
Building stuff that people want and are willing to buy and pay for. Seems
Right.
like a no-brainer, Mike.
Seems like a no-brainer. But again, innovation costs, right? And so
Yep.
a lot of these organizations, while they see it, they look across the aisle at what someone else is doing. Again, dollars are tight within a health system. So innovation is wanted, but not always funded. So when you talk about what can we do, it's based on the budgets that's there for it to be done with. You have to keep the lights on for clinical care. Front office, back office takes a lot of dollars. Um, your doctors, your nurses, they need systems that are reliable, that provide the data that they need. You've got to have that decision support tool ready and available to them at all times. So that's
Yeah.
why AI is being adopted a lot faster, because now decision support has an ally. It's another component that takes that brain from thinking out of a physician's head and moves it into another place that's reliable. Like I said, they've tested within up to 86% reliability um, for an augmented reality of care.
Yep.
So how do
Yep.
we take that augmented reality and now transition it into actual functional use within the health system? And I have a client that I was just at it not too long ago, and they're starting with the basics of HR interaction, and they're moving through the organization.
Mm,
Their job is to take this AI tool, this AI platform, and they're going to move it through their organization in a very methodical fashion. But at
yeah.
the end of this, they already know the efficiencies and the outcomes they're going to achieve.
Yeah. That's fantastic. So, we're talking a lot about, what are the challenges and opportunities within these hospital system leaders. And, so let's say that they have funding, they have some strategic imperatives, and they go out and they source these technology solutions for it. They sometimes spend multiple millions of dollars on these, on buying this stuff and implementing it. And then now what? You and I talked recently about the gaps between I sourced it, I evaluated, I made a choice, I bought it, we have it implemented, and then this huge adoption gap, both with those internal stakeholders, and we kind of touched on this a little bit, and those external customers. And how are we really generating ROI from that investment that we made if the healthcare professionals aren't going to use it, or only 5 or 10% of them are going to use it, or the patients and those caregivers that we had anticipated that were going to use this aren't using it? There's so many gaps around adoption. What are your thoughts about that?
Um, Starting with the end in mind, experience transformation has to be thought up front. It has to
Yeah.
be circulated. There has to be a strategy developed around it. That experience transformation is very important today because that leads you down change management.
Yeah.
Again, back to the old days of who moved my cheese. If you're starting and dropping this in on the young lady that's been there for 25, 35 years doing the same thing, and all of a sudden you're like, hey, we're innovating, we're changing your world, it's going to be better for you, and she's been used to doing the same thing every day, your experience transformation path has not been thought through thoroughly. And so experience transformation is around technology, peoples, and process. And how do you look at those? And technology is always the last thing you're looking at, right? It's the
Absolutely.
people and then the process that comes first. You make sure that they're comfortable with this path and this strategy and this roadmap that you're developing. And then you work on the process. What's going to break? Here's how it's going to break. Here's how we're putting it back together. And here's why it makes sense for the organization. And when it makes sense for the organization, this is why we don't have to get rid of jobs, because we're going to have more money to fund these other things where people we move to increase revenue for the facility. And then the technology will be, here's the technology that supports what we have on this roadmap and within this plan. So as we talk about buying those tools, as we talk about going out and investing in new technology, new platforms, it is starting with, here's how the people will use it. Here's why they will understand how they use it, because it will provide this outcome for them and for the system or for the institution itself. But making sure that everyone's bought in from the executive team all the way down within the organization on why we're doing this. And here's why it makes sense, and get your champions on this experience transformation.
And a strategy that I think is often missing in this equation is kind of lining those adoption plans
Mm-hmm.
alongside of that diffusion of innovation. Because if I'm rolling out new tools, whether they're AI or telehealth or whatever they are, if I'm rolling out new tools for clinicians to use in our oncology department, um, within that subset of that population, there are going to be people that are innovators and early adopters that are looking for the new things so that they can provide better patient care and be able to make it more efficient or be able to help more patients. But there are going to be some people that are going to be more of that later majority or laggards that are going to be completely resistant. And so developing those adoption plans that are tied to that, really being able to identify them, and then being able to build awareness and demand from the right segment of that audience first, and then
Mm-hmm.
using those people that are using it first that are happy with it, and then facilitating those satisfied stories so that momentum and that energy is being used to then persuade other people within that department that yes, this is safe, now it's tried and true. Because for the first people, they need to hear that it's new and exciting and never been done before, because that's what gets them going. But then the next group of people, they don't want to hear that. That scares the crap out of them. They want to hear like, this has now been tested, it's used, it's the new standard of care, and now they feel a sense of reduced risk and perception of risk, and now they're ready to use it. And we just are not using that type of methodology or framework in this. And I think that's a big reason why we've got such little widespread adoption or scaled adoption across an entire ecosystem.
I call it creative tech FOMO, to be honest with
Yes.
you.
Yes.
I create tech
I like
FOMO.
that. Yes. I'm going to use that.
Right. Because when one person gets done with their work faster
Mhm.
and they're closing up, going home for the day, the person that's the laggard that still hasn't completed, I promise you, it doesn't take them long to jump on that train and hold on with both hands.
Completely.
And so you're 100% correct. There's always going to be the laggards in adoption. And I will tell you, I've done large deployments, large companies, global companies for deployments. I remember one of my first O365 deployments. It was a global company, and we had our pilot group. Then we had our test one group. But before we were finished with test 1.5 to getting into 2 and 3 were like, so when are we on board? What time scale are we on? Can we move that up?
Exactly.
It's crazy. And this is decades ago, right? But
Yep.
once folks start seeing that they have the ability to go faster, and there's someone in the organization that actually is going faster and being more efficient, and they
Yep.
maybe look at it a different way as you're a thought leader and you're moving the dial within the company, it changes the optics, one of IT and those tools, but of the executive team that has made the decision to put them on this roadmap.
Yeah.
Because we're providing you an efficiency. We don't want you here till 8 o'clock at night doing work. We've got to put tools, people, and processes in place that allow for you to do your work more efficiently. So we take on more work and the company can grow. Less people, growth using tools.
Completely, 100%. And FOMO is real. It's everywhere, no matter what industry, no matter what country, no what geographic location. Like, it's a real thing for
That's
sure.
right. That's right. And so we talk about that. That really helps this adoption of AI. Once the buzzword hit, everyone started downloading, right?
Yep.
It only took 8 months for us all to start, 8 months from go, and we're all sitting here with Chat GPT on our phones and on our desktops.
Right. Testing it with so much doubt and skepticism and putting in, well, what instructions would you give to a patient if they were discharged with this medication in this condition? And they're like, holy hell.
Right.
Exactly what we would say.
Right. Right.
Right.
And so we just finished we call it an AI panel for one of our Georgia hymns here, and it was really sitting three physicians in front of us and having them, what are your thoughts around AI? And they all saw merit in AI, but not your delivery.
Yeah.
And I understand where that comes from, right? I understand that. And most people say they have a selfish outcome. They have a selfish interest. No, they have an interest in care and making sure a patient gets the right information based on the protocols and based on their specific needs for care. And I don't think AI is there yet. I know AI isn't there yet for saying, based on all of these life standards that you have in place, here's your care plan to the best of my ability as an AI bot or as an AI tool. But a physician can look at the whole continuum based on his knowledge and say, no, we've had some outliers here, and this is what's going to affect you more. And so I think that's where we're headed in the future, of increasing that efficiency with AI and augmented health.
Mm-hmm.
But I think that it's going to take some time to get there.
Yeah.
And not a long time.
No, not too long. It's happening faster than we think. That's for sure.
Sure.
So as we kind of like start to wrap up here, is there anything else that you would want to share with the audience?
I think as we start looking at these tools, Roxy, it's how do you bring in the right people from outside your organization to help you evaluate? How you take a workshop that you haven't done before in your organization and use that workshop to develop a strategy for new innovation, for transformation, and for implementation of
Hmm.
these tools that
Yeah.
touch your people, that touch your internal processes, and target revenue. It's okay to target. Hey, where are cost constraints? Where are there revenue opportunities? Put those on the board and help
Yeah.
you understand. Here's what this tool is going to do for me. If I spend this money to bring in this tool set, what's my outcome, and who's the best provider for that? Can you, as a consultant, advisor, or whomever, come in and help me point to the right person or technology to perform these tools that are needed, or perform these actions that are needed using those tools? And so it really is, I think, once you're inside the box of an institution, it's hard for you to think. There's things that are needed, and now this tool will help you think a little bit more. But someone that's seen a global view of using these tools can help you a lot more. And again, there are plenty of consultants out there. Throw a rock in a crowd of people, and you're going to hit five. But is also looking at who are these people that are staying apprised of what's happening in these industries, and
Yeah.
that have seen more than one industry and can help innovate from startup to fortune, and help bring that continuum of insight into your organization. I think that is how we offer an advantage.
Yeah, it's interesting because a lot of people that I've had conversations with over the last few months seem to have a very tainted perspective of the word consultant. I think
Hmm.
some of the large consulting organizations have kind of just given that name a bad name, of lack of value, or, I've got this, I paid a couple $1 million and I've got this oompty oomp PowerPoint presentation, but how is that really having any type of business impact? How would you describe what you're doing or what we do, like in a different lens, in a different way?
I call it an experienced advisor.
Hmm.
So I'm an experienced advisor because I've seen across multiple industries, multiple various. I mean, I'm all but one, all but oil and gas. I've touched every other industry. I've deployed in every other industry but oil and gas.
Yeah.
For
Yeah.
all the listeners out there. So it is really how do you take that experience across all of these industries that you've deployed in? You've looked at solutions, you looked at people, you looked at the technologies you've used, you looked at mergers and acquisitions, and how do you divest one company but provide technology for the new company that accelerates what they're going to do? These new companies they're being spun out and carved out because they've got some root information that's very valuable. Their data set's very valuable. Their analytics are very valuable. But how do I put them on a hyper engine that accelerates a new technology being used, and those technologies being used that can bring revenue to the parent company, right? So I'm going to spin them out, carve them out, let them go do what they do best with these
Yeah.
new innovators. And I think that bringing that back to these large companies that are usually slower. They usually can't get their hands around this innovation as fast. If they start to look at who internal to those organizations can work with someone that's an experienced advisor, and those experienced advisors can help you architect a roadmap and a solution strategy that fits within your budget planning, within your cycle of innovation for the year, you will reap the benefits that I've seen in other industries. That's astronomical. There are reasons why other industries are not they're not feeling the economic downturn that some are,
Yeah.
um, and there are
Hmm.
nuances there that people some pay attention to, some don't, and you'll see people that are paying attention to it. They're not really rubbed the wrong way by talking about innovation like AI, right? They're welcoming it because they know they can go faster and they can put that in their tool bag, just
Yep.
like you're doing with your experience transformation series for innovators. This is an innovators talk show, so it is. How do you take that innovation? It's a book right above me that talks about the innovators toolkit. I've had that book forever. That innovators toolkit is still useful today because it's how you think, whether it's from creating sales opportunities, marketing yourself. But these tools today are marketing tools and revenue generating tools because they create efficiencies and
Yeah.
cost reductions.
Love it. Love it. Love it. So, Mike, you and I could talk about this stuff for days,
Yeah.
but we have to wrap up at some point. So, thank you so much for joining me today. I'm so glad that we finally made this happen after all of this time. I appreciate your time, and thanks for joining me on the show.
Thank you for having me. Looking forward to seeing you in person soon.
Yes, at the health conference.
The health conference. Looking forward to
Yes.
seeing you there.
Sounds good. So if you, as we wrap up here, thanks Innovators for joining us today. Feel free to just subscribe to the channel here, subscribe to the show on your favorite podcast player, and I'll see you on the next episode. Thank you so much for listening. See you on the next episode of Health Innovators.